I will call this meeting to order of the Weston County Hospital Board. Do we have a quorum?
Yes, we do.
Okay. Ben, would you mind leading us in prayer? And
Sure.
Gary, why don't you do this? Starting with the pledge? Yes. Okay.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please bow your heads. Lord Jesus, we thank you for everything you provide us. We thank you for this hospital. We thank you for all the people that work in this hospital. And we thank you for the blessing we have of just having the efforts that are put out. Lord, we ask that you be with us tonight as we meet and discuss business, that you guide and direct, give wisdom. And we thank you so much again for the new people we have and for the progress that's being made. In your name I pray, Lord Jesus Christ. Amen.
Amen.
Give me a little bit of water.
No, sir.
A little bit more.
No. Oh.
Yeah.
So how do you feel?
Okay. So do we have any visitors and any visitor comments? Any visitor comments? Any visitor comments? Okay. Do we have any additions or changes to the agenda?
I have a question on, I looked at November 5th and it looks like William and I are listed as visitors.
On the agenda,
On the minutes? November 5th?
Mm-hmm. That special meeting.
you are. Oh, that's nice that you noticed.
It said, okay, because it showed like we were maybe attending online or something because we weren't in the ones that were present.
We'll fix it. It must have been from the previous meeting.
That could,
Thank you.
well, because
The minutes also say November 5th and it's actually November 4th was the meeting.
Okay.
It's November 4th.
Oh.
It's November 4th on the. It's on the agenda, correct. Yeah,
Yep, but on the minute.
but on the actual minutes, we just have to change that to the.
I will fix both of them. Thank you.
Thank you.
On this agenda,
Mm-hmm.
is the date.
Yeah, so we're actually on the.
Okay, let's hold on just 1 minute till we have all the minutes and then we'll get to the agenda.
Are we on the minutes now?
Yeah, we're on the minutes right now.
No,
Or at least that's what we were talking about.
we have to change the date on the.
Okay, so
All right,
which do
I'm
we want to deal
confused.
with
Never mind.
first? Do we want to deal with minutes first or agenda first?
Agenda, that's what I thought you called.
Okay, all right, so we'll deal with agenda first.
Did you do additions? Do you want, I guess?
So oh, yeah, no, we have to do the
have
approval of
to
the
do-
minutes is first.
Yeah.
Well, we have to fix the date on the agenda. So I don't know if that goes
Yeah,
under agenda
that-
or minutes.
Right, so on the agenda, we need it to be November 4th
Are you talking agenda or?
on the agenda.
Because our agenda
Right
says
here.
November 4th.
No, right, or yeah, so that's right.
no,
The November,
our special meeting was November 5th on a
No, it was
Wednesday.
the 4th. The minutes date is wrong. That's why I'm all confused on where we're supposed to address it.
Was the minutes on the 5th? Show the 5th?
The minutes say the 5th, but the meeting was actually on the 4th.
It was?
Yeah.
On a Tuesday?
That's what it says in my.
I think it was weird.
Yeah, because it was a special meeting.
Yes,
I
we
thought
had
we
to
met
do it
on a
on-
Wednesday.
we were talking about doing it either Tuesday or Wednesday. We ended up doing it on Tuesday.
I got it on the 4th in my calendar.
Yeah,
So
it was, yeah.
Oh, yep.
It was Tuesday.
Okay.
So this just needs changed on the agenda, or that's the same on the agenda. So number 5, approval of minutes. A should be October 16th. And the date up on the top on the agenda should be November 20th. So I am sorry, Denise, I should have looked closer.
Oh, she had it changed. I think it just, I don't know what it did when it came back over to her, if it switched,
Yeah.
because it was a document that we took from
One thing
to the other.
Yeah, so anyway, I should have looked closer when I was looking at it.
Whoa.
Okay, so is there, and then also on the agenda, William, you have something on the agenda.
Well, just a question on the last part, upcoming events. I don't quite understand why past tense would be used for an upcoming event. What,
You know why? Because when this person was thinking about it, it wasn't here yet. And so I put it on the schedule. And I'm sorry for that, because the last meeting, if you remember, it said to be determined. And so then I put the ribbon cutting on here. And that's just my fault. It's an error on my part, sir.
because now, as of this moment,
already
it shouldn't be there.
I understand.
Okay,
Have a
thank you.
suggestion? If we just remove the word upcoming, then the heading's called events.
I like it.
Okay.
There we go.
Stops people arguing over time. I don't know who would do that, but
People
birthdays.
Yeah.
Only
Okay,
them.
so are we good on the agenda? Is there any other?
additions or changes?
Yes.
Yeah, I would, Madam Chair, I would like to be able to introduce Paul at the beginning of the meeting before the strategic initiatives.
after what item?
After item 7. Is that right?
Mhm.
Which is where we are sort of at right now, sort of.
Right.
Okay.
Except we didn't.
The other change that I need to
I
make
know, we
on
still
the
need to do
agenda,
The minutes have been.
sorry, I forgot on the agenda piece. Tish declined the meeting, and so Paul will be trying to do what he can with her report.
So we'll we'll change Tish for Paul.
Perfect,
Mhm.
thank you.
Mhm.
What word?
There's the corrections.
What item?
Okay.
It's bottom of page, bottom of page.
E number.
Just
Got it.
changed, and then we're up here.
Could have just said under finances. It would have been easier to track the discussion at that end of the table.
Okay, so now, oh, I'm sorry.
No, I'm good.
Okay. Okay, so now is there any more things we need to talk about on the November 4th minutes, the special board meeting? We got the date changed and we got Dottie and William off of visitors. Is there anything else on those minutes?
On the minutes?
Yes, this, so
Yeah,
The November, we're doing the November 4th one.
but not just as before.
right, yes.
So. The answer is yes, if I can find them.
This is it, Beaker.
Oh. It's a one pager.
Yes.
That one, excuse me. Fine.
Okay, good. Okay, so now on the October 16th minutes, do we have any additions or changes to that?
I do, under the finance committee report, it says Medicare approvals, increased nursing home tax, it should say Medicaid. Okay.
What page are you on?
Page 2, under finance.
Thank you.
Okay, anything else?
Medicare changed to Medicaid.
Correct. Thank you, Mary.
Okay,
On the same page, a paragraph above, HR Rebecca Mark. Yeah, it says we filled the open position with internal candidate. For people that will read these minutes at some future date, looking at what position?
It was the HR
Generalist.
assistant, wasn't it?
Yeah,
It wasn't
it wasn't.
generalist. She wasn't generalist at the time.
That's correct.
She was HR assistant.
What position is being filled?
The
HR assistant.
I think it ought to say that.
Okay,
Okay, we'll put it in.
Thank you.
Enter Allison into the
Oops, fine. Okay, yes, go ahead.
On page 3, along the same line, it's on a foundation board report. What is it? This did not meet since the district's last meeting. I mean, foundation meets, district meets, everybody meets, so who are you talking about?
Okay. So the hospital board district.
That's it for me, thank you.
Okay, thank you, Ron. Thank you. Do we have any other? As far as minutes go. So there's no more updates to the minutes. Does, do we have can I have a motion to approve of that, approve them?
Make a motion.
I'm a little bit late. I'd like to make another suggestion.
Okay, go ahead.
Bylaws. And Mary and William, I know Mary and William are, but would we put trustees and William and Mary?
Or the last.
Well, trustees work for me, but you're right. Either way
Either way.
would spell it out.
Mhm. Yeah.
So in the future, somebody looking back at
Yeah.
this one.
Yes.
So I will move that the minutes as amended be approved.
I'll second.
Okay, so William moved, Dottie seconded. Okay. Now, let's go and officially, will somebody move to approve the agenda as changed here a little bit ago?
Madam Chair, I move that we approve the agenda as changed.
Okay. So Ted moved and Ben seconded. I haven't voted on either of those. Okay. Okay. How do I manage that? So.
what's the
Let's
name of it?
restate them and the first one.
Yeah.
Okay. So it's been moved and seconded that we approve the minutes. All those in favor say aye.
Aye.
Okay. All those opposed, same? Okay. It has been moved and seconded that we approve the agenda. All those in favor. It's been moved and seconded to approve the agenda with the changes discussed. All those in favor say aye.
Aye.
All those opposed, same? Okay. So we have approved the minutes and the agenda.
And then minutes as amended.
Minutes as amended.
And the Yes.
agenda. And the agenda.
As amended.
Madam Chair. Sorry, I feel like I made a mess of that. Okay. Okay, so now I think we are.
The introduction. Yes, so I'm going to be short and sweet, but this is Paul, our new CFO, Paul Milano. I say it right half the time still. And so I'd like to just tell you a little bit about himself, his background, and what we've been up to.
Sure, absolutely. Nice to meet everyone. I've been on site for about 4 days now, a whopping 4 days. It's been very exciting. Here's my voice. So a little bit about me. I come from Philadelphia, Pennsylvania. I have a degree in finance, 2 undergrad degrees in finance and economics, a master's in business administration from Rutgers University in finance, and a master's of business analytics from Georgetown University. And so I specialize in everything finance, data, and analytics. Most of my career outside of the military has been spent in private equity, investment banking, and healthcare operations.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
So I specialize in everything finance, data, and analytics. Most of my career outside of the military has been spent in private equity, investment banking, and healthcare operations. So I worked on everything from small little ambulatory surgery centers all the way to, one of the largest hospital systems in the entire country, George Washington University healthcare system. So I was part of both of those types of acquisitions and operations. I have very unique experience in both RCM, clinic management, all the way down to mergers and acquisitions from some of the biggest banks in the United States. I came here because I really believe that healthcare in rural America is under attack. If anyone watches the government, knows about the CR that just passed, everyone here knows that premiums are about to skyrocket and the most vulnerable populations are about to get crushed. And so I wanted to bring my skill set from Wall Street all the way to here to help everyone understand how we can do better financially and do well by our constituents and our patients, people of Weston County. So, thank you.
Thank you. And in the 4 days, we have ran like crazy to get stuff done. You've done a very good job. I'd have to say, yeah, it's been very good experience so far. We've got a lot of work to do, but we've done a lot of work as well.
Yes. So I'll just be brief with these comments, but there is a litany of financial stuff that we have to cut through. I am confident that I possess those skill sets to get it done, but also to get it right and for it to continue to be correct. I look forward to having a posture of compliance and complete transparency, not only with the board, but with our citizens, and make sure that no mistakes happen in the future in the finance function.
Good.
Thank you very much.
Good to have you.
Happy to be here.
Okay, so we ready for?
Oh, before Paul, I'd like to hear it once from your mouth, the official way to pronounce your name.
Yes, sir. Milano.
Thank you.
Kind of like the cookie, Milano cookie with an A.
Well, I didn't know the closer you get to the Mediterranean, the more vowels and everything.
I'm Sicilian.
I do that too, and I try to even put
Thank
an
you, Paul.
Italian accent on it, but I'm still working on that, so.
Don't call me late for dinner, all right?
All right.
I'm just gonna call you Paul.
Yes, sir. Perfect.
Okay, Polly, I think we're up to you.
Okay, just a little information. Quality did not meet in November. We had some committee members that were sick, including myself. So there isn't a whole lot to report. With the quality piece, I've been working on the cart abstracting tools and the EDTC, which is the Emergency Department Transfer Communication portion of the quality reporting. And today I was working on routing surveys and things like that hopefully I can get out to everybody else. But other than that, things are pretty on the down low. Everybody's working on their PI projects, just plugging away, and things are just kind of status quo. So does anybody have any questions for me? Yeah.
I just want to make sure we keep on the, as far as the quality review, we're doing the transfers and
The ambulance piece, yeah,
piece.
yeah.
Not that you have anything to address this month for, but I just want to make sure let the community know that we're still talking about and reviewing. So
We definitely are. Thank you, sir.
Anything else for Paul?
Poor Polly, nobody has anything for poor Polly. Thank you.
You're welcome. Thank you.
Sorry, it wasn't more of a report. It was kind of short and sweet.
Okay, as long as we took over the minutes of the agenda, we.
Yeah.
That is good. Okay. Okay, so, and Mary, I assume you probably don't have anything since
I do not, since we didn't
we didn't have a meeting. Yep, okay. Kim, are you up for the Manor?
Yeah, so we do have some credentialing. I'll touch on that first. We've got some radiology doctors. We've got Dr. Brisk, Dr. Kennedy, who are new credentials, and then Dr. Huskerwood and Dr. Folsom, who are reappointment medicine concerning in any one of their charts. And then Kelly Randerman is at the clinic, and then Gordon Stewart is at emergency. For you when you're ready. Moving on to the Manor. Our current census is at 52. Our occupancy rate is at 89. We did have a resident pass away. I believe it was yesterday.
So what's the difference between a census and occupancy?
How much of the beds are full?
The percentage of beds that you have available.
It's 89%. Got it.
So we're 89%.
89?
89. We have no beds. Would be a lot in a short period. We admitted 30 overnight.
It's too late to do math right now.
Okay, anyway, we got it. I'm no longer confused.
Yeah. Our payer mix, we've got 30 Medicaid, 5 Medicaid pending, 15 private pays, and 2 VAs. I did hand out our 5-star rating that we just received today. It does look like our overall rating dropped from a 3 down to a 2. Our quality measures went from a 3 to a 4, so we did increase that star, but our staffing did decrease from a 3 to a 1. And it says on here that the nursing home was reduced to a 1 star because no staffing data was submitted. So I do have an email out to Jane to figure out maybe what happened with that reporting period. We did just have another reporting period. It was due November 14th, so we did get that submitted. We should probably see that around February. I'm hoping that staffing star will come back up. He did say that there was a quarter where he'd gotten multiple reports sent to him and the wrong one may have been uploaded, but I just want to confirm if it was this last reporting period, because that could be part of that problem on that 1 star. And I am thinking that because we dropped 2 stars on our staffing, that is why our overall went down as well. But the packet is there for you guys to look at if you want to dive a little bit deeper. We did have 1 admission in October, 2 discharges due to death. We had 2 residents get transferred to the hospital and they did come back. Current agency staff, we've got 10 CNAs and 1 RN. We did recently hire 2 CNAs and a dietary manager. I'm hoping here in the next 6 to 8 weeks, we can get rid of 4 contract staff based off of where some of the CNAs are at in their testing process and getting temp license and things like that. So that'll help save some money on the banner side as well, what we like to hear. Staff education, we did get a donation for some dementia training for our staff. And I did get that disseminated out to them. So they are getting that dementia training through Tika Snow, and she's renowned for her dementia training. So the staff are going to be working on that. And then we do just have 1 complex resident that is in the Manor right now that we're working on. So that's it for me. Good, thank you.
Okay, okay.
You guys should have your report. Carrie had asked that we provide additional numbers this last month, and so what I did is I went back to January and have provided you numbers for each of the providers coming forward. We did hit 759 patients this last month, 91 with Kelly Raderman, our new MP. Another thing that you're seeing on the bottom are the days worked by each one of the providers, so you can see that based on that number, like Dr. Hayward, they worked 13 and so on. The year-to-date numbers that you will see on the bottom is kind of what we want to talk about for stabilization. Basically, since the pandemic, we've been losing about 25% of our clinic numbers since that time. We are seeing a trend that it has started to come back up. Just so that you are aware, you will see from last year, the numbers were at 41,000, and year to date right now we're at 30,000, which is really good. We have current model right now is that we drop from 13 to 10. We do have Dr. Akers that will be leaving us in December. His contract is up.
And we have decided that, due to the current staffing model right now, that we are going to possibly just keep him as a PRN and not as a full-time provider. One other thing, we have, despite our efforts this last month, we have seen a little bit more of a downtick. We are utilizing some called off hours, which has been nice for some of our people to be able to leave earlier, and we're watching our numbers very carefully. We're monitoring our patient engagement to try to provide stabilization and try and rebuild our clinic volumes. This is going to come from outreach, strategic planning. What we've decided to do is I've reached out to the senior center, and once a month we're going to be doing education with them. Our first conference will be on the 17th of December. Dr. McCarty will be our first doctor up. We're going to be talking about seasonal disorders and diabetes. That brings us to our November quality project. Is we are trying to promote diabetes education. We are offering 45 free A1C tests if you do not have a pre-diabetic or diabetic diagnosis. You can do a QR code that's on a flyer that will be advertised on our website pretty soon, that you can go in and take that test. And if you flare high, you can come in and have a consult, which we will bill to your insurance, or do a sliding fee schedule. We're just trying to get more education on diabetes out, since that's what the month of health is for November. That also brings me to my next thing, is that each month we are going to be tackling another area of concern. So December is the SAD, in which we're going to be doing a lot of advertising that Charlotte will be putting out on the website about activities and just trying to seek professional help. And then we will be doing a few giveaways as well in the clinic, making sure that everybody has a warm pair of gloves, that will be stuffed with hot cocoa or tea or something like that, just as they come in, to make them feel that they are appreciated and warm. Through January, we're going to do cervical screening and radon testing. February, American Heart. March, colorectal. April, alcohol awareness. May is going to be skin cancer screening. Spring is going to be men's health. July is going to be sun and water safety. August is going to be national immunization and nutritious meals for children returning back to school. And September is going to be cholesterol. And then October, we're going to do breast and lung cancer screenings. And then we'll be back to diabetes education. So if you have any suggestions or want any additional things added, we'd be happy to do that. We are continuing to work and review our workflows and our processes. One of the things that we have found and has been on my radar since day one is that we did not have proper enrollment, which was making our cash come in slowly and our claims go up very slow. Since Inova has taken over, we have identified areas of, let's just say that certain drug processes, injections were not pulling through on the claims and not being filled out correctly. So that's been an area of big concern that we're focusing on. We do have an auditor within Inova that is scrutinizing, and she reports back to me on Tuesdays and Thursdays. Anything that she does have, she's reaching out directly, and then we're reviewing that together to make sure that we're capturing all of that. Our goal for this next month is to really improve our patient satisfaction scores and develop a strong flow following of our providers. We are seeing that the numbers are steady, but we really want to make sure that our patients understand that we are here to stay, and even with a little bit of work that we've had with the RAFs, that we are doing this for the betterment of our community and the survival of our hospital. I did attend a conference on Monday in Gillette for the 211 for the nationwide advocacy. It was very interesting to see all of the resources that are available to our community, and Heather and I were both there. And I think that as we see our community grow, I hope that we can both become advocates and reach out. There's over 3,200 resources that are available, not just right here in our facilities in our area of Newcastle, but statewide. So it will be really nice to be able to be a partner and partner with them to be able to help any of our community members that need that assistance. But overall, I feel like that our clinic is doing very well. overall, I think that our people's satisfaction, our working environment is wonderful. And there's a lot of collaboration happening right now. Deb is very strong in the diabetes. She's actually becoming certified, and she's handling and being our champion this month. And that's what I'm trying to promote, is each month having one of the nurses take control of what we're doing and run with that advertisement.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
Working environment is wonderful. And there's a lot of collaboration happening right now. Deb is very strong in the diabetes. She's actually becoming certified, and she's handling and being our champion this month. And that's what I'm trying to promote, is each month having one of the nurses take control of what we're doing and run with that advertisement. Do anybody have any questions? I know that's a lot.
That's awesome. Thank you. I really like that education piece. I think that's so needed. And
She's doing a great job, and her team's doing a great job with her. I mean, it's a different group of people working together now, so I appreciate that very much.
any other questions? Okay, so it's up to you, Rebecca.
All right, I follow that. Thanks. So, I passed out a couple of things. First, my report, and then we'll get into the benefits enrollment for 2026. But I wanted to open with the fact that I filled the last vacancy in my team. So I have another HR assistant on my team. And last month, I mentioned to you one of my goals was to focus on our I-9 audit. Compliance is pretty important. So because of that, I've already ahead of schedule. It's got my new hire, her name is Tanya, working on that already. So I really hope to have that completed fully in January of 2026. And when I say completed, audit of the I-9s goes all the way to identifying what we're missing and those deficiencies, and actually involves pulling employees in on certain days to collect documents for signatures. So maybe we'll meet an earlier target, who knows. So the next topic is 2026 benefits. I know we touched on that last time. Honestly, I think we all know we're a little behind. That won't be my intent going into 2026. Certainly not making excuses, but I walked into that in process. And so it is what it is. But the good news is we don't have any significant changes this year. Gallagher is saying we have about a 2.8% increase in benefits. That's particularly on the medical side with Blue Cross. So Tish, Kathy, and I looked at it and had them run scenarios, and we're really proposing the 50-50 split, with half of that increase going to Weston and the other half going to the employees. And those numbers outlined in your packet. There are no changes to the contributions proposed for HSA. Standard and Delta Delta, all those numbers remain the same. So I don't know how this completely works, if it needs to be on your agenda, but to move forward with open enrollment in December, I would imagine we would need some sort of approval from all of you to make that happen.
Yeah, is a recommendation that I wasn't here for a second, but I'm assuming that it is that we recommend the 50-50 split with the employees on the cost. And you mentioned the overall 2 point.
Yes.
Okay.
Yeah. And what I did forget to mention there is Gallagher communicated to me in the last email that they're continuing to negotiate. So we will see some numbers decrease, which could have put us closer to budget, at least to put Tish communicates.
So whatever,
Do we
so,
want that this month or next month as far as the,
well, it starts in January, but it's whenever you want it, whenever you want to be able to, firm it up. As far as the total amount, if you're waiting for a total amount, I guess we would have to wait till next month, correct?
We could.
Did you give them-
That need enrollment, so the first payment of benefits by the employees.
How about this? Could you consider making an approval for this budget? I know, we'll talk about it. This budget for now, I know what you're gonna ask me. And then that's my recommendation, and then we can come back if there's any kind of change to the numbers in the right direction. As far as Blue Cross Blue Shield is concerned, the only reason we're staying with them is because we were unable to get anybody else with the timing to provide that was willing to take us on. I think it was some timing, but I also believe it's because, I don't know, claims data, something like that. Our risk pool is small. And so we really couldn't get anybody to take us off of from the trust to their services straight on. So it's, a disappointing moment for us. Only thing I can say is our stop loss pieces in that we've done pretty good. We've been able to get dividends from our insurance companies. And to be honest with you, with all of the work that we're doing, I think that this is the part we're just going to have to really consider this is what we have available for 2026.
And to add, they did look also at removing us from a self-funded plan.
That's what I meant. Yeah, sorry.
Yeah, that's okay. And Gallagher asserted that isn't financially feasible for us. I'd like to explore that further. I think now that Paul's on board, Kathy and I will have that support we need to plan much earlier, which is my philosophy. I do not like being behind the eight ball like this at all. And it's not the work that you can expect from me in the future, for sure.
And the ICRA is a biggie idea. I do not want to do that, where people go out and buy their own insurance, basically was one of the proposals they had as well. It's kind of like doing the Obamacare, only it's called ICRA. And I don't want to worry, I guess, that people have the insurance that they need based on, did they go out and get their insurance or not? And are they going to have coverage and that sort of thing really concerns me. So of the options we had, I still have to recommend for this next year that we stay with Blue Cross Blue Shield's plan. And our vision and stuff, that at least didn't change any. Vision and dental didn't go up at any part of it. Sorry, you don't like my answer, but go ahead.
Well, first of all, I haven't had a chance to look at it all, and we're an oversight board, and so we have to look at what the bottom line change on the budget is. So could you tell us what that is?
That's it is at a 2.2, right?
2.8.
Not 2.
But I want to know what the
No, it's 2.
difference.
You're talking percentages. I'm talking dollars. No,
Yeah.
yes.
I don't need to know percentages. I just need
It's
to know the
2.3 million.
dollars.
And we paid basically the same this year.
No, so I think we as a board need to know what the total overall for the year difference is between the three options before we could decide.
Did you look at that to be able to present that from the records you have?
No, and honestly, I did not know till last minute that Tish wasn't going to be here to present her part of this because all I have is, I understand. I just, because like I said, we're an oversight board, so we don't look at it like, down to the minute or for the employee portion, but we have to look at how much it's going to cost the organization as a whole. Option 1, 2, and 3.
They did give us that information, so let me look through here for a minute.
Yes, you are.
But wouldn't that be, if we're going to share 50% of the increase, if I'm understanding right, wouldn't 1.4%, like over what they're charging us currently, be 50%?
Yeah. Yes, it is, exactly. And all I can tell you is like for an individual, it's about $8 for, you know, for them. And then our part of it is $8 increase. So the overall increase has to be on here. So I haven't looked at it for a few days.
$8 a month, $8 a fee.
So I'm looking at where the page entitled 2026 medical contribution scenario 1.
Where are you at? Which,
I don't know.
oh, medical contribution, 2%, yes.
So this, the one that says no employee contribution
It's the
increase,
page before, Kathy.
if I look at the employer contribution, the annual cost is 1.934. Is that, am I looking in the right spot?
The
Right
total,
here. And then employer cost.
employer cost is 1.934. That's correct, but the total premium is this 2.334. So that's between both of them. So this is supposed to be 1.934. Thank you. And then this is with no employee contribution increase. If you go to the next page, there's the 2% piece, and the total cost to us is still about 1.9.
Less.
Yeah, 1.926 and 2.334. So the one that we're actually recommending is that we have one that is a 50-50 split, which will then make it 1.923, basically.
And how does that compare to last year?
Yeah, last year, well, okay. So last year, I wish I was looking at Sage right now, but last year we paid right around 2.2 million. And one of the things that's a variable that you guys need to know is that there's a portion of the Blue Cross Blue Shield bill. You want me to stop for a minute? There's a portion of the Blue Cross Blue Shield bill that we get in January or February that has anything for the last year or two that might be out there that didn't get paid sooner, basically. And so then what happens is we have to shore that up as well. So this figure is for straight out insurance for the year, but we spent, I think it was 2.25 or something like that million this year, which is what we wanted to try to get away from, but we don't have it.
So just one quick question, and you might not be able to answer this.
No, I thank you for challenging it because then I can look at it again for a minute.
So is one of the reasons this is so expensive is because we had so many draws on it this year?
We had some high claims. We had, but the interesting part is we actually ended up getting a little bit of a little bit less for several months of it. But we have a couple of outlier employees that's costs. And of course, you don't know who they are, and we're not supposed to know, but whose costs went into the stop loss piece. So we pay $75,000 per employee, and then after that, the stop loss insurance covers. And so those people that go over that were in the 400,000, and there was one that was over $1 million. So the good news is, compared to our groups, we're doing good with stop loss insurance. We don't have a real challenge with them because we don't have as much utilization, I guess, as that.
So will it be as expensive next year with not having that $1 million?
Yes, it definitely will. But I got to tell you that we have a new HR person, and I think paying attention, I look at the stop loss reports every month, and I can look at how they're doing. And overall, we did pretty good with stop loss. Like I said, we have a few outliers, but there really was only a couple that were real high. And so one of the things I want to do is try to figure out how we can negotiate a lower amount that we have to contribute into it and not have, and maybe have our stop loss insurance a different factor. So, and see what the difference would be with that. So in other words, okay, we don't want to cover 75,000. I don't know if you came up with that number, but we want to drop it down to $60,000 instead, and then pay a little bit more for stop loss insurance, and really be able to drill into those numbers and see what our total costs were. Yeah, exactly. And then I think we have to look at our risk pool with them as well, because we do have some changes relative to age and tenures and things like that that we need to compare to. So there's more work to be done, and we felt like the least painful for all of us, given that we're in the situation we were in, was a 50-50 split.
So we're talking about basically a change to the budget of 63,000, correct? Actually 52.
I think, yeah.
From the 50-50 split.
In that bottom.
In scenario 3. Yeah, I have to catch
This,
it.
I think,
52,670.
if I'm reading it correctly,
Thank you.
does that work? I think.
Yeah, that works. The math works for me.
So.
Is you're in it for the fun?
Yeah, I love folklore and storytelling, and for me, Halloween is we celebrate it. We do the costumes, and I love to watch horror movies and eat garbage, and I don't, my kids' candy. But I've heard it said that sometimes horror movies, ghosts, monsters are really just metaphors for the other things we're really afraid of but can't address directly. Maybe it's healthy to get this out of our system. As a kid, if I heard a bump in the night, I'd be terrified. As an adult, if I hear a bump in the night, I'm terrified. It's the furnace and I have to pay for it. It's just maybe it was fun sometimes to be afraid of things that in most cases couldn't really hurt you, instead of worrying about debt or child abduction or, cancer or something that really is a threat. It's fun to be afraid of things that can't really hurt you.
So it'd be an increase of.
So this year's this.
So that's the least, three.
Guys, can we just tell you one other thing real quick?
So when we're looking at the financials right now, I can kind of blunt with everyone here. I don't have a lot of confidence in the numbers that are currently presented. What I would like to do for the board,
Numbers on this.
On the P&L.
on the P&Ls.
Oh, okay, which we haven't got to yet, right? Yeah.
Correct. I'm happy to.
However.
Stop real quick. Third page in there. So the whole plan is, I believe that if I go back, we shore up the books, and then we examine this on a basis, we'll be able to have a cleaner delta so that everyone can make an informed decision. I probably need about 2.5 weeks to do that, just because where the books are at right now. And then I can come back and present to the board exactly what the picture looks like between all three scenarios.
Right now on these books, it's showing us that we're at a 1.5 million spend rate at the moment.
And if we're saying we're halfway through the year, double that, that's 3 million. This says 2.2, so that's an 800K difference off the top.
Yeah.
But this number, we believe, is inflated and misallocated. So we have to go look at it, reclassify, get a cleaner number, and then re-examine.
Is it possible that might include the catch-ups that you were talking about?
Yes, it does include that, I can guarantee you.
But that's budgeted.
Yeah.
We would reclassify that out of the current period because it's a catch-up. We're doing it for Will County. And so then we would look at it on an apples-to-apples basis to actually see the impact in that current period.
Well, I would be much more comfortable if we wait to discuss any increase to this until we know.
Yeah.
And I'm good with that, but guys, what are we gonna do to make sure that we can get people enrolled for January 1st? I don't want to pressure you, but I gotta say, you're either gonna have to have a special meeting when we come up and shore that up, if that's okay.
We have to have a special meeting.
Okay,
I'm up to that.
yeah.
I mean, I get,
all special meetings, unless it's a special reason.
I understand, and I understand what you're saying, and I feel the exact same thing. But to Kathy's point is, we almost don't have a choice.
Well, I guess that's my next question. Is there any option other than that? Other than these here? There's not, right?
No, again, to Kathy's point, no one wanted to
based on our risk pool, I assume that Gallagher, who represents us with some of our carriers, you know, we've kind of, in the past at least, let them spearhead this whole effort. And so, that's part of the reason we're behind the 8 ball. I'll be honest with you, and I'm not trying to defer blame here. Gallagher was very late at getting us what we needed, final numbers. And so I knew I was up against a soft spot with that, plus that I needed cash and so on. But open enrollment typically was scheduled for November, but I calculated today, I can run open enrollment in December because again, January 2nd is that first premium payment.
Well, what they're telling us, just so we look at that front page again, or the 2026 overview, the medical RX administration part has they put 3% on there. So it's a 3% increase. That's very modest in this industry. So I want you to think about that too, because usually it's a double-digit number and we're looking at a single-digit number. I mean, it costs money, and yes, we want to look to see what we can do. I personally think we need to look at a mix between our stop loss insurance and what we are willing to be able to hold.
But for this year, with the options that you were presented, you actually chose the least costly for it.
Right. And unless you look at ICRA, we would have saved $274,000, but I feel that's risky for us to do with our employees. So
I just talked myself in a circle. I don't know if we have, I mean, this year, I don't think we have any option.
No, unfortunately.
I don't like giving that to you, but give me another year. And
It's not your guys' fault either.
yeah.
That's for sure.
So
I'm back to saying we don't have another option.
we're not considering a special meeting.
No, not now. I don't think we should. I don't know.
Okay.
What's good is it gonna do? We're gonna be back the same spot we're at now anyway.
No, I guess the argument is we're up against it.
Yes.
Yeah.
Yeah, and I
And
don't like
the
it.
management with what you guys have, your team, you chosen the option with the least cost on the total bottom line. So I don't know how we could ask you to do anything different.
Least cost to the district.
Least cost to the district. Yeah.
And the other pieces that that I might mention is that we had them, they went out supposedly to 6 different other payers for bids on insurance, just straight out insurance. We didn't get any.
I'm not surprised because, yeah.
I just want to point out there's basically $11,000 difference between us picking up the 100% and the employer going at 50/50 with the employees, which would leave the employees with no increase.
So, but we have done no increases for the employees for quite a few budget cycles, and I think it's fair to split the cost of the increase with them. And especially in light of the fact that it's a low increase this time. I mean, if it was a 15% increase, that would be hard to take, but I think it's fair to split this increase.
They also, just so you remember, they got a better deal on it last year when we had a higher amount. We took on more of the cost. So we still have that built into this. So we're really only splitting a very small part of it with them.
Well, the county did get in the quandrum in some ways by eating those increases over a number of years. I think the county is now at 93 or 94% total premium versus when it was supposed to be an 80/20. So you can work yourself, but also it could be considered, if the employees would consider that the possible raise in benefit to is a raise in salary. But I also understand what you said. So.
Well, and the raise in salary, remember, we agreed that we were going to talk about after we got through a quarter or two to see where we were at before we started to talk about that.
Sure.
Well, especially condition of the financials and policies coming out. And think the most conservative thing to do would just do the 50-50 split at this point. Maybe next year we can go back to.
Any other thoughts?
So are we as a board comfortable with a motion to move forward with the package presented with the 50-50 split?
Well, I don't see why for $11,000, it just doesn't pick it up and just be done with it.
I'm fine with that too. I'm just gonna present I just presented what I thought was an option, and I'm good with whatever you guys do. I really am. It's whatever difference you want to do.
If I was trying to work with employees, it seems to me that you get your money's worth for $11,000.
Sometimes though, it seems like I want to see them, which I don't know that insurance really works that way, but I just think like the hospital, we're trying to make the hospital work and trying to, I mean, I know it's only $11,000, but it just seems like it would be better for the employees to share it with us.
If you guys look at percentage of cost share, just if you look at it for a moment on all three, the no employee contribution increase is an 18% share for them and 82% for us. You go to the next page, it's a 19% for them and 81%. And the next one is 19% and 81%. So really you're talking about a 1%.
The delta, yeah.
Mm-hmm.
Just, can I put a question to our HR person?
Mm-hmm.
Do you see, perhaps I'm just imagining something that doesn't exist. Do you see any benefit to be able to tell the employees there'll be no raise in their contribution this year?
Oh, well, absolutely. I think besides compensation, people look to their benefits and the cost of that. So I think anything like that, you get a boost of engagement, motivation from people. If I answer that correctly,
Well, I don't know. I'm going to assume you did.
I want to make sure I heard it correctly because I heard the last part of it.
That's responsive to what I was asking. Thank you.
I just don't know. I mean, I'm not arguing Rebecca by any means, but do we really think we're going to get any value out of the $11,000, or we're going to keep employees over that issue, or lose employees, or gain employees, or this year? I just don't think is the right time that we
I agree.
have that
And
concern.
to Ted's point, we don't want to end up where we have to do big catch ups. You know, I mean, we've eaten the large increases for them, and I feel like it's time to go back to
Well, and I would,
where we have to split
if
the.
I knew exactly where the financials were and I felt really warm and fuzzy over, how we're doing, I would feel much different about it. But if we can save $11,000 right here at this point, I just feel that's the responsible thing that we should do. I mean, I'm all for keeping the employees happy, but they also have to understand we're trying to save the hospital.
We had a document, and I don't think it's in here, that showed what it was for each plan as far as their increase on the employee side. It really wasn't much.
I think Gallagher rated a bit from final.
So, Rose, go ahead, Ted.
Well, I'm arguing with myself.
How's that going for you?
Well, it's a good argument.
Both sides are good.
Yeah, both sides are right. There's no loser. Now, what I'm thinking, okay, I don't know financials, what they're going to look like. Do our employees deserve a raise? I believe all of us believe their employees deserve a raise. If we can't give a raise, $11,000, we can give them something. That's all it's going to cost the hospitals, $11,000. And I know it may not be enough to change whether somebody wants to quit, go somewhere else, or wants to come here. And it just,
Do you have the budget with you? What did we put down for the final budget number on that? We've done so many variances on it, but I don't have that in front of
I
me.
was wondering that same thing. I couldn't remember.
Here he has everything, so.
Now you got me on the spot. I'm not sure I.
yeah, with mine out.
That's the high point of the meeting for me. Put you on the spot.
Thanks, William.
I guess I think in the scheme of things, $11,000 is just not a big deal.
It is, but it isn't.
Well, it's,
Yeah.
I don't know that it is. I mean, when you look at everything,
When
I think if we could offer that to the employee, I know that it would only be 1 point whatever for them,
For $8 or whatever it turns out to be.
but maybe, I don't know.
It looks
I
to me
just,
like it's $44 a year. If you divide the 11,000 by 250, which I know that's a rough.
but I just think that for $44, we should do it.
Now, I'm gonna only remind you of one thing, because I can't help myself. You all gave me, I had to really work for a budget. And I have certain numbers that I have to hit. So this decision that you're making may impact what choices I made. And I just want you to be aware of that. Okay?
I know, see, you've been working hard to try to get to
Yes.
that budget.
Yes.
And. we
All
want
right.
to-
Thank you very much.
Under.
Okay, so benefits, we did budget 3,085,000. So there is probably room in there, but I could say, I don't know, because we gotta fix this again, but I could easily say we probably spent around 3 million too. Right now it shows 1.5, but. Okay, so benefits, we did budget 3,085,000. So there is probably room in there, but I could say, I don't know, because we gotta fix this again, but I could easily say we probably spent around 3 million too. Right now it shows 1.5, but. So I'm just saying, I think you can probably do it. I'm gonna remind us of the budget every once in a while when we make decisions.
Madam Chair, I move, just to get things moving. I move to accept the proposal for a no employee contribution increase.
Second.
All those in favor say aye.
Aye.
All those opposed, the same.
Aye.
Aye. Aye. Nay.
Nay.
Okay, so the motion has passed 4-3.
Okay,
Seconded?
so can you then
Then
you'll go back to them and let them
Second.
do that plan.
That would be very.
Who seconded? Who seconded? Can't believe that one. It's usually the CEO that wants to not have the employees pay anything.
Yeah, it was, I agree.
It's not us that's been staying up all night worrying.
Yeah.
And I don't think the $43, that's an actual number, is gonna make or break anybody or make a big decision on, but it may help.
Well, I'll be sure to let you know, so.
Yeah.
But thanks for getting the
Very,
options.
yeah.
Yes, yeah.
Find out for
absolutely.
us.
Okay,
Thank
so
you. Thank you, Rebecca.
there's still recruitment on your.
Yes. I feel like I should have put that first, right? So, I know Kim touched on it, but I'm pretty proud to be a part of it. So I'll just summarize here. There have been some turnover in the dietary department, particularly with the manager leaving. But I'm really excited because the new manager is an internal candidate who expressed interest when she saw it. And I'm all about promoting growth internally. So that excites me. And I'm also glad because, you know, our assistant manager was
still trying to fill in for the manager role, struggling at times, and I get that. It's a demanding job. And so she had a lot of openings on the cook side and the dietary aid side, but we had 5 cooks open and we now only have 2. We're about to fill the other one. So, and dietary aids as well is almost full. So, and that's really only one department. Dawn, who's on my team, she just got promoted to HR general and she's doing a fantastic job of pushing on recruitment. So I just had to mention that. So,
So just a quick question. So the internal candidate, was she not from, or were they from dietary or from somewhere else?
yes.
Oh, very good. Oh yeah, it says they're right there. Okay, is there anything else for Rebecca?
Thank you.
Yes,
Thank you. Thank you.
Yeah, thank you very much.
Yeah, thank you. Okay, now where are we at on the agenda?
Somebody mentioned that, but
Right there? Oh, are you ready to eat supper? Okay, so now we're up to the finance report. Carrie, do you want to start? And then
I
I'll let Paul
do.
go.
I have a couple of things for all the board members. Kathy had, we had talked about ANOVA starting. And Kathy obtained figures from ANOVA. Kathy obtained figures from ANOVA about where we stand right now in our accounts receivable. And so we thought that this would be a great baseline for where we could start taking a look at ANOVA and monitoring their performance. So if we start here at where our accounts receivable is right now, we would like to go down from here. And so I'm giving this to all of you guys as something that we can use in the future as our baseline to determine how ANOVA is doing. For accounts receivable, they were given all of the insurance accounts receivable on September 22nd, and they were given the self-pays in October. So, yeah. So just so that we can keep this as a baseline and move from here. This came across my desk in my personal life. I'm not pushing Cognizant at all. It is a clearinghouse. I just thought it was a really nice overview of what happens when you go to using an agency. Kathy's been telling you about all the internal processes and the internal work that has been going on here to make our new RCM successful. And there's a lot of behind the scenes work. And this document just did a nice job. Of course, they're trying to push their business, but it nicely laid out all of the things that Kathy and her team have been doing behind the scenes. And I just thought you guys might enjoy, looking at the different processes and hopefully recognizing how much work Kathy has done. When we do this like we have, there's usually a period of strife in between while we get everyone into their new roles. And the fact that our strife is as low as it is right now is due to all the planning that Kathy and her team has gone through. And I just want to say thank you for that. So,
Can I ask a question? Just tracking correctly here.
yeah.
So how long has the self-pay been? How many days then have they had self-pay?
They got it in October, just a couple of weeks.
Okay.
I just found out from Epic we put in a ticket. I know Epic sometimes runs slow or fast depending on what you're trying to do, and it's never fast enough for me. But they just now got the self-pay people into the training module, so they're going to be doing the training module starting today. They should have, and that I think takes them a couple of days to get completed, and then they should be able to work to self-pay.
Okay, that's good. So just again, I'm asking the question, just backing. So we have 313,000 over 180 days in self-pay, correct? That's what this is telling me.
Correct. That is correct.
And that's our second highest area of total income, right? 975, 32%.
Yes, correct.
Okay. Wow, all right.
That's what that was.
That's why.
Heart wrenching, and it went up from where it was before. If you guys remember, we were at about 685 a month ago. So that's my concern.
So
Yeah.
hopefully
Nobody's been working at it no one's been working at it for 2 months. Is that right?
Right.
Because nobody was working at it before we.
They weren't getting them. They weren't getting much cash in. That's for sure.
Before we sent it to Nova, and Nova is just now getting credentialed to do it. Or I don't know.
They're credentialed now, and I actually put. What did I certify like 40 things this week to make sure that we could get into the systems and everybody could get in with all the payer pieces that we needed and Pecos and that. I had to change and update all the managers and all of everything had Sandy on it.
So what our goal would be from this point forward is for that not to grow.
Mhm.
And what I mean, this is Kathy and I don't want to overstep, but what I would hope that we see is now that we have this new company on board billing and collecting, we would then work on internal processes to make sure this doesn't grow and doing more proactive things. Like we talked about collecting copays in the office and providing patients with actual costs of things and working out pieces before their services are rendered.
And the process
So that they know.
workflow for pre-authorizations too. That includes every department.
And I mean, that is not only good for our bottom line, but it's what we owe our patients. The patients have to, cost is a big factor in the decisions they make on what services they receive. And for us not to be able to tell them that until later is unfair to them as well. So,
Right.
another project for
Well,
great, but I'm sure that was already on your plate.
oh, it's all my plate.
So I thought Mary had a question.
So is Dr. Akers now credentialed for
Yes,
insurance?
he is. He is now credentialed and they're doing any billing of people that weren't. We only have one provider that just today, as I got all the rest of them done, but we had one that was not, Mary Beth, you remember when she was here, she was somehow deactivated or whatever. So we had to do some work to get her reactivated. So she's the one lagging out there. And that was from this summer. So we still have time to get the bills in, but we are trying to get it done as fast as possible. So I worked on that today.
Dr. McCarty is one of the big ones that they just got recently credentialed to. So they'll be dropping all of his claims from June.
So
onwards.
everybody's on board.
Everybody is on board that's working here currently, and then there's only one lagger that doesn't work here anymore. And so I'm hoping to see the cash flow start to, everybody's had training, we're talking, we have weekly meetings at least, and then I have a weekly meeting, Paul will have a weekly meeting with the owner of the company and make sure that we're feeling like things are progressing the way they should. And we have a 30-day out. So if we don't see what we like, we figure out something else. But I want to see how it goes now that we've got things in play.
We have to do this.
Can I ask one more question? And I love the baseline, by the way, this is good. But why do we have under the government section, which I'm assuming is VA and those kind of things, why do we have 74,000 over 180 days?
Okay, for part of that, we had a whole bunch of VA bills that were held up because we weren't billing them to the correct place. So that was part of it.
I knew there had to be a good answer. for
Local,
that.
yeah.
And I'm not sure if railroad Medicare is in there or if it's in Medicare, but that was it.
Yeah, that was a big one too.
Piece
Yeah.
that they just recently got straightened out.
Yeah, the VA, and then actually the VA has changed some of the rules for the Manor now. And so I'm trying to read those and we'll have to see what it is that we have to do. But I did ask Inova to pick up the VA billing for the Manor, to pick up the people that are on long-term care insurance. And then we are working on and formalizing, I gotta get it to the attorney still, some letters that will allow us to, we needed to put something in front of people so that families actually, when somebody's gonna do a pending Medicaid, that they actually have 5 business days to get their paperwork in. And then we're also going to start asking for the Social Security to be their payee, and then the resident will have $50 allowance. That's what they allow, but we haven't been collecting that. So we needed to assign ourselves as payees so that we get paid something well over the Medicaid. So we've not had anything from them. Well, those are being worked on.
And
I
the
hope we'll get
last
money in
thing
there.
that I have is the upcoming deadline is, the latest upcoming deadline for us is December 1st for our cost report. And Paul says we're on track. And I'm
Yes.
sure he'll talk more about that.
Yes, haven't talked about that right now. Just on real quick on this note, we're meeting with Inova constantly. I met with them today about getting APIs, so application program interfaces. I know I promised you guys dashboards and analytics, so that's kind of what I started with right away. And we're working on getting that information in real time in a wonderful format that's interactive that you can always see, so you don't have to wait for emails and spreadsheets to come across. Much clearer.
But they do like those.
We like these.
Okay. Well,
Don't forget about these.
however you want it is provided, but we have to make sure it's accurate and that it's not
Right.
engaging. And so one of the things that we're really focused on is that denial portion of this and how they fight those denials and how quickly they can get rebuilt and approved. So that's something that I'm going to be meeting with them about weekly to make sure that doesn't pile up and this AR does not keep aging. So that's all. With respect to the financials and the internals, we have some cleanup to do, and we have to do it very quick. Part of the discussion we had, I believe it was Tuesday night with Finance Committee, was that we have two different parts of the state level audits that we have to meet. We have some cleanup to do, and we have to do it very quick. Part of the discussion we had, I believe it was Tuesday night with Finance Committee, was that we have two different parts of the state level audits that we have to meet. One of those is called an F-32, which is basically a cost report that's unaudited that goes to the county level individuals. And then we have a state audit level report that has to have all the audited financials going to the Department of Audit for the state of Wyoming. So those are two separate things. We did submit the F-32. However,
To the county commissioners.
correct. However, we don't have internal proof that we actually submitted the F-32. But after conferring with legal counsel, I believe still on the call here, we talked about whether or not that's even a necessary item if it's not just a nice to have, right? At the county level. Now at the state level, it's totally different. The state level, that is a must have, and it's due December 31st, actually. So that's the deadline, the drop dead deadline is December 31st. After meeting with Alicia
Is it on the,
Jump, I put block.
is this the cost report or the audit? that
This
we're
is the
talking about?
audit right now.
Yeah.
So after talking with Alicia Jump, essentially we told her the situation about the financials, how they needed to be cleaned up. And we put forth a plan of action with Alicia to let her know exactly what we're going to be doing. And I'll brief that to you right now. So essentially by 12/5, we're going to clean up all the internal financials on the trial balances, make sure everything ticks and ties from a TB, a trial balance perspective. By 12/15, all the financials for the entire hospital for FY24 and FY25 to date will be completely audited and shored up from a finance package perspective and get ready to be submitted to our auditors, our external auditors, DPZ or DZB.
PDA.
Thank you. 4 days in, give me a break. So once that happens on the 15th, essentially what will happen then is they have an 8-week timeline to complete their external audit where they then review all of our financials and then certify the information they have and package that up and send it to the government. So we're anticipating sometime in February for that to be completely done and in the hands of the state of Wyoming. Now, once we connected with Alicia, she had said that we have until April 1 to get everything in without any further penalty. Currently, they're holding funds for the hospital at the state level. And once we pass these financials in, they're going to release those funds down to us. But until then, they're going to hold them as a penalty. Moving forward, this is simply just not going to happen. There is a month-end close, a quarter-end close process that takes place. All of that gets rolled up at the end of the year. And within 15 days at the end of the year, we will submit our financials to our external auditors for review and submission to the government. I'm happy to take any questions you may have.
Let me just say, praise the Lord.
Agreed, sir.
Go ahead, Kevin.
If we met the criteria for county government, does that mean we continue to get our mail levy?
We're still continuing to get our mill levy. I talked to Nathan today, Todd, and we also put a letter together for them and Alicia said that they could call her to say that they're very aware of our situation and are working with us because it's important. They know how important it is for us to get this done. And Nathan said, hey, don't feel alone. Other people got a letter notice from that, just part of the process. Allison did some work for us as well, and she looked at some different statutes, but at this point, at least she told me that I could breathe now a little bit because we at least have her. She says the sooner we get the 24, obviously 25 audit in, the release of our money will come through for us. But we do have that April 1st deadline, and we're hoping to be
well
before that. So February. Okay. We'd be sooner, but DZA won't bend.
Yeah, we tried that today.
Yeah.
How much of the delay in getting the state portion done is due to us, due to DCA, or due to God?
So
that's okay. Go ahead.
Okay. I believe that it is a split responsibility, both internally and externally. And I think that there were shortcomings in communication internally to DZA and DZA to us. And so my recommendation to the board would be at another time would be to probably find another auditor to work with. But then again, internally, a lot of this was simply not done.
Thank you.
Yes, sir.
And on note with that as well, we had a conversation with DZA because they never notified me of any of the work that was not completed. And that is their responsibility, and they did own it. They said, you're right, we should have had you in the meetings and stuff. So we have the audit sheets now.
Yes.
We know what has to be further worked and reconciled, and we know what things were not done. And we've been plowing through them on these 4 days.
Yes.
And
if I may, just really quick before you comment, we asked them for any correspondence between us and them that could show that they had asked us for things, and they could not produce a single piece of correspondence, not an email, not a text message, not a smoke signal, nothing. So I blame them just as much as they want to blame us. And quite honestly, that's exactly why I would want to go with someone else moving forward. I just simply don't trust them.
When you said that the state of Wyoming is withholding our funds, what funds are we talking about?
I think that the ones that they're talking about are the you know how they go and do the mix and look at what you're at and what that percentage difference. There's some part of that they reduce the total percentage of what we get, and I'm trying to remember what it was going to be, and I think it's somewhere in the neighborhood of a 10% cut on our overall reimbursement.
But they're not right. So they're holding like a catch up or whatever, but they're not holding like our
No.
Medicaid reimbursements to the nursing home or anything like that.
No,
Okay.
they're not. They're not. They're holding a percentage of it, and I mean, so in the transparency of that, as we've all been in this meeting, we know that we were told a different scenario that we were simply waiting on DZA. So that's where I'll leave it.
Did I miss anything from finance committee?
No. I have one more piece, if that's okay.
Yeah,
You have your whole, you have a whole report.
You're
I'm getting off that.
yeah, you have quite a bit left, so whatever you're on.
Which one do we, I feel, I do not
Just tell
feel
them to
good to
put
bring this information to you right now. This would not be an accurate statement by me, and I want to maintain my credibility to the board. So if it's okay, I'd like to forego this, get you the right financials, and we can hold a session, and I'm happy to brief them top to bottom for you.
I have the sense you're gonna do that, no matter what it is, you're gonna do that.
It's
Do it.
last but not least, we do have one addition to the team in the finance department, Mr. Scott Mock. He's going to be in the procurement space as a manager.
Okay, so tell us what that means.
Materials management.
And essentially he's going to be working to get all the materials for the hospital and make sure that one of the larger issues that we're working through right now is the inventory valuation and how much that actually is on our balance sheet. And right now it's very, very, very highly overstated. And so we have to go back in through the SAGE system, clear all of it out and redo it. And Mr. Mock is going to be very instrumental in that process.
We have to redo it. Didn't we just do it?
Yeah, well, yes, there, you did recognize a termination rate. I've told you about a termination in that department, so.
Yes. So that's why it has to be redone.
Yeah, because work wasn't completed and no, anyway, accountability had a problem from the leader that was over that person.
We're going to make it right. And that's all I have. That's okay.
Just makes me want to know.
To end on, we're gonna make it right. I'm all in.
I'm all in.
Okay, so is there anything more you want to add after having been thrown into the fire for the last 4 days?
You know, I just want to say how thankful I am to be here. This is the exact challenge I wanted to have in my career at this age. And I really think that this is a unique opportunity, and I'm happy to partner with Kathy to get it done. And I couldn't ask for a better partner. So thank you.
I would like to say ditto.
Yeah.
All I hope is that it's not going to be this challenging moving forward.
It won't be. And that's the beauty of the process, right? So each month we're going to go through our own internal reconciliations, and then each quarter the same thing. And then when we submit to an external auditor, all that stuff is already done. So it should be a 30-day process. And all of it will be clean, ticked, and tied, and we'll be able to present it to the board, not have these issues, not have these overstatements.
Do you think we should wait till next meeting to ask about bank reconciliations?
No, I think we should ask right now.
Sounds like board heaven.
But wait, Mary had a question. No, I didn't. Oh, you didn't? Okay. So what about, have the bank reconciliations been being done?
They have been being done. The interesting piece is the bank recs to the SAGE accounting system don't agree. And that's really because of the timing issue. As I said before, we're in accrual accounting. I know who it is that's doing the input for the accounting. They're not following the tenets of accrual accounting rules. And so there's always a break. And so we have someone working on that every day. But the banks, you know, they are what they are, and the money coming in and coming out typically matches, but there are breaks that we look at. And it's really because it's a date issue, if that makes sense.
Yeah, an example even too is our salaries and wages are overstated by $3.4 million.
So is that, so that means.
It's an artificial inflation.
It's an artificial inflation, yeah.
So is that, so when you look at the paperwork, is that a?
That's why he doesn't want to present anything.
Well, this is the reason why we budgeted the $3 million that we did. We were looking at that number. That's why it happens.
I know, I did the best I could with that budget.
No, I'm not saying, yeah. We were going with the numbers we had at the time, but that's.
So one thing that I'm grateful for that I'm seeing right now is I'm just so grateful that you are being a true help.
Although I'll say he runs me around for the last 4 days, quite busy, so.
Keeps you young, right?
Yeah. I like being able to, I feel like I have that professional level that allows me to be able to partner stronger, and help find, and we can knock things out pretty well together because we have a way to work.
Is that finished Paul's report?
Yep. So is there any more on the finance that we need to ask, or should we move on to Kathy? Move on. Okay. Thank you, William. You're keeping me going. Okay. On to you, Kathy.
Okay, I just wanted to let you know that Dr. Franklin is looking at going from 2 days a week to 2 days, 2 times a month, or 4 days instead of 8 days. And he wants to do that in April. So in the meantime, I talked to Carrie Foster, who's one of our people that comes from a company, but I said, what do we have to do to maybe look at, are you interested in coming here to work? And then how could we look at bringing you on for us, and maybe even depending on the schedule we can work out with her, we can actually do some changing of the schedule that we need to do, because Patrick would like to go down to 2 days a week instead of 3. They're feeling the pain, I guess, of being busier. And so they don't want to work more than 2 days in a row because we're busy, which I love. And I'm like, I'm okay with you being busy because I am. But we want to make it work lifestyle there too. So Carrie Foster is looking at it. She sent me, I told her, send me what you really want, and then we'll have to negotiate what you can really have, basically. And we got to work with the other providers to look towards that. The reason that I talked to Carrie Foster is she was recommended by Dr. Franklin to talk to, but I talked to the nurses, and the nurses really like working with Carrie Foster, and she gets good compliments from our patients base. So that's the reason to look for. She actually lives in Cheyenne. Is it Cheyenne? Oh, Scottsbluff, but she works in Cheyenne. And I'm actually trying to see whether she's interested in quitting the Cheyenne gig and having enough hours here that we can make our schedule work. And she was actually interested in that. She says she loves working here. So
She's MD.
That the only thing that I will say is that we have a Dr. Zimmerman that's a doctor, and he might have picked it up. And he thinks he does okay, but he's not as charismatic with people, and I guess is the word I'm going to use, to invite business like I'd like to be able to try to grow.
And the truth is,
we don't really. And Dr. Franklin said he was committed to still doing the medical director role. So, well, I mean, it depends, because we have a medical director for the Manor, we have a medical director for the clinic, and we have the medical director for the hospital side. So as long as will come to the meetings and do the things he needs to do with the medical director role, I'm okay with it.
the truth is we've got doctors, we've got MDs over at the clinic.
Yeah, we do.
And so if it's not like they aren't available.
Right. Right. And so, and they've actually been working more like a peer group, and that meaning that we're not just glossing over stuff sometimes, and we're actually having conversations about improving quality and standards of care. So it's uncomfortable for them at first, but they're having to live with it. So we're doing okay with it. And they want to do better, but it's just hard for them because they're not used to it. Is that a fair statement, guys? Mm-hmm.
Is Carrie Foster a nurse practitioner or a PA?
She's a nurse practitioner, yeah.
What does that do to the current contracts?
Well, that was the other piece. I just hadn't gotten to that click mark yet,
Okay.
but the rest of I need to really look at all the contracts and then try to standardize them a little bit more. I did update them with Allison when I first started for the ones that came in since then, but we have got some crazy ER contracts that, in my opinion, I don't know that Paul agrees with me yet, but it's like, everybody has a different kind of pay for Sundays, if they work the weekend, what the holiday is, and I need to look at tenure and all of those things, and then have one scale to look at and try to get them a little more standardized. The other thing is that they're asking for an increase in their pay and the ER side and the hospital side, because they haven't had an increase in 3 years, those that have been working here for a while. So I think that's a fair request of them. But I'm going to have to look at the whole, what does it look like, how much we paying, and how much can we afford to pay them to increase it. So I don't have that to bring back to you. I told them to please bear with me. I'm working on the audit, and they've been really good with me, but I want to try to get something done if I can, by the end of the year, so we can start the new year.
Well, that's really talk about different models that we possibly table.
Sure. Yeah.
So there are several, and I'm sure you're aware, there are several different physician payment models that we can actually bring forward for consideration to the physicians and the board. What I'd like to do is spend some time, and once we figure out the budget and understand exactly where we're going, figure out exactly what that would look like and present it to you all for a vote.
This place is full of love. You can tell the people that like to be with old people because they really take care of you good and are very kind.
Twice a day, every day, activities people have an organized activity that's always interesting.
Everybody loves to play bingo. We play it 3 times a week here. We also have ceramics that you can paint. Really pleasant to live here. It's a good place to be.
So there are several, and I'm sure you're aware, there are several different physician payment models that we can actually bring forward for consideration to the physicians and the board. What I'd like to do is spend some time, and once we figure out the budget and understand exactly where we're going, figure out exactly what that would look like and present it to you all for a vote and see from that perspective, from a data-driven perspective, where we should go. That helps.
Yeah. So that's going to be coming to you because I don't really want to replace our staff. So I think getting somewhere with 3 years is a long time to wait for an increase. Okay. So.
And the one just encouraging note is, I think a year ago you were saying, I can't even find the contracts.
Yeah.
So you aren't saying that right now.
No, I might still have to slug around for one, but we can find contracts is a messy. So trust me, I spent most of the day finding them. So, with that, the other thing that I wanted to bring up is that, and I think you mentioned it, but Kelly Randerman's doing very well for us. Did you mention last month that we may have a problem because one of the businesses her husband has 2 businesses. One sold, the other one was sold, but it got pulled back because the person fell out from the loan piece. And they're still trying to work on that. So we're trying to work on some sort of deal where we can still have her here a certain amount of time until he maybe does sell that business. And then she could come more full time, but she could at least be here and work our schedule in such a way that maybe she's here 2 or 3 weeks out of the month. And then, because she's got good numbers, if you looked at her numbers for being here, we've actually taken care of it 30 week,
She did 91 patients her first 3 weeks.
No,
And
the youngest kiddo, what was the?
at 33 weeks, he was seeing this last week. So
That's really good. And she's training, Trisha's making sure that Amanda and the staff are all getting training on pediatric care and pediatric norms, that sort of thing. And Kelly's taking the helm on that as well. So I kind of wanted to emphasize Kelly. She's also taking on, I'm really proud of the providers actually, because Kelly's taking on the whole wellness piece and how they're going to get their documentation done correctly. And they have a 2-note process that I won't go any further because it's too granular. And then,
we're actually billing for annual wellness visits as well as regular office visit now through Epic. Before we were just billing a regular office visit and not getting paid for the annual wellness. So Epic has a process that we can actually do it on a 1-note with 2 notes on there. So.
And then John's working on putting together the guidelines and starting an anticoagulation clinic. So that'll be good. And then Craig's going to be the guy that's going to put the guidelines and pieces together for the diabetic clinic. So we talked about those things. Those are all opportunities for us to be seeing patients on a regular basis, have standards that the nurses can follow without having to call the provider, unless there's outside of parameters, and provide more ease in managing patient care. Well, smoothing that out. So the last thing, I think that I think I told you that I did send a letter addressing the letter received from the county so that they understand where we're at in that process with the audit. And I'm looking forward to it being done very soon, someday, somehow. So we will have it done. The other thing is that we have a proposal that we got from Elevate CPA and CFOs who prepared it. And it's basically a proposal to use a CPA as an accountant at an hourly rate of $100 an hour. But this person has forensic level understanding of finance and the general accounting principles. And so what we're hoping, what we're going to get out of that is not only are they going to clean up some real big GL work we need to do again, and they will also be able to have a forensic eye for if there's any irregularities that we need to be able to report out to people.
Right. And
Go
I
ahead.
have to comment on that. So essentially, there's a lot of rework that needs to be done at the GL level. We currently don't have that talent internally outside of myself. I'm happy to work with this person to do it together, but it's just way too much to be done by the time we need the audit to be submitted. And we're at the point where we need the books to be exactly right so that we can have a clean slate and a fresh start moving forward. We won't have these problems again. So I look at it as this, we have an upfront investment now. We don't have to do it again later. Yes, ma'am.
Where did the girl come from?
I know this person personally from my time in investment bank. It used to be before. So I know it's going to get done right.
And he has a deadline, so, and he's comfortable with the deadline we gave him.
So how significant are the problems with the general ledger?
Very significant, sir.
The mapping's not correct, Ben. Hasn't been right from the beginning.
So you anticipate at the rate of $100 an hour, the total will come to?
Well, that's the thing. Until he gets in there and knows how much work is there, I don't know if I can give you an hour's estimate yet. But I'd like to be able to have the freedom to make sure our audit goes through and we don't have any worries relative to our status with the state.
Take what you expect and double it.
Mm-hmm. I know that doesn't give you one a range that we could start with or something, or?
No, I'm fine. But I was just gonna make the comment that I believe you have one or two budgeted positions in that department.
I do. That's correct.
So
we do.
So they have salary.
The idea, if I may, is that
Thank you.
after the cleanup happens, we keep this person on as a fractional controller for high level accounting issues and making sure that at month end and quarter end, we run through together so that our packages are exactly tight for submission to the outside advisory board. And so if that happens.
So the outside advisory board, is that us?
No,
He means the state.
State.
Okay.
Yeah, sorry about that.
Sorry, I'm just wanting to.
Maybe I should have said audit, we were talking to the advisory board. I apologize.
No, that's okay. I'm just trying to build.
No,
Where's
understood.
I can verify that he doesn't go to bed till after 1 o'clock in the morning. So,
I'm trying to figure out exactly what's going on here. And the truth is that it's a lot to walk into in 4 days, but it's something that I know we can figure out, and then we get this thing back on the rails and power forward. It's nothing that we can't handle. It's just a lot of upfront rework, and then having someone in the wings that is going to be kind of a partner in crime into making sure that the packages are perfect at the end of the day for audit and review. So
What
we never have to do this.
when we get to a fractional place, we'll bring a different proposal forward for that. Okay. So this is just to get the cleanup work.
So would that, like something that it feels like we've been missing as a hospital is somebody who will teach the people here how to do accounting.
Yes, that I can do that at my level. We already have one of the staff doing healthcare or accountant for healthcare through the University of Michigan. And she just started that, so I assume that she'll do that quite well.
Okay.
Quite honestly, if I may be so bold with the board, it's only like 15 or 30 different types of journal entries. It's not exactly rocket science, right? Or rocket surgery.
Right.
there, but
Yeah.
it's one of those things where it's quite easy if you have a cheat sheet. And so the problem is twofold. One, the debits and credits aren't going the right way. And then for an audit, two, you have to have the provenance to back up every debit and credit that they want to kind of review. So we have a two-pronged issue, right? So we have to go back in, fix the debits and credits, make sure everything's recorded the right way, and then provide the support for those debits and credits. And yes, I can teach the person, whoever's the accounting staff, I am teaching them right now on how to do that. This person would be like more on the longer term side, is more of a check and a balance to the process we already have to ensure that our process is correct. So it wouldn't be like a P&L heavy item for us. Think, in the $1,000 range, not $40,000, $50,000 that we're paying for an audit, if that makes sense. This is just a press of a button to make sure that we're good to go. Second set of, you can
Another
think
set
about
of
it
eyes.
exactly an internal audit level.
I think I do think that will help us keep ourselves out of that question mark that we've had is even just having that fractional component once we get it cleaned up, because that's an outside person that has a responsibility to us to assure the board and myself, Paul, that those things are going right. And to be honest with you, we have some good strategies for moving forward with growth too. So I kind of want to have an accounting person doing accounting and a Paul doing the finance and doing some growth strategies.
We need a motion to do.
Yeah, you do.
You want it, yeah.
I make a motion that we give Kathy the ability to bring on at $100 an hour this individual to help do the accounting work as
Called Elevate CPA.
Elevate CPA, as Paul has mentioned.
I'll second that.
Okay, it's been moved and seconded that we give Kathy the freedom to hire this
Elevate
CPA at $100 an hour to help get this cleanup done. Do we have any discussion?
I don't know if she needs to be emancipated, but being given freedom. We ought to just authorize her to do it.
Well, you guys give me a budget to work within, so I'm always.
I said freedom to be on.
Okay. We changed that word to authorize. Any other discussion? Okay, so we're ready to vote. All those in favor say aye.
Aye.
All those opposed, same. Okay. So it has been, it has been, the motion passed for you, Kathy.
Thank you very, very much. Just wanted to remind us all that this is Rural Healthcare Day. We've been so busy being rural health givers that we haven't talked about it much, but I'd like to celebrate our staff and the work that they do and the work that's done in the rural communities so that we can thrive as well as anybody does in the city, and probably better because our air is better. So they do a phenomenal job, and we do have our employee appreciation dinner this Saturday, and from 6 to, if you didn't sign up and you still want to come, that's okay, don't worry about it. But we have it from 6 to 8, 8:30 or 9. What is it?
Starts at 5.
Okay.
Upper at 6, 4s and 7s.
Yeah, and we've got some nice people that are going to be receiving awards. They won't even tell me everybody that's getting one. So I think they're being very sly, but I do know of a few, and it's going to be a very good time.
What time again is?
6 o'clock to 8.
It's coming.
5.
It's here.
Oh, 5 to 8. Oh, for cocktails. If you want cocktails, it's 5 o'clock.
Oh, there we go. That's what I get for not reading.
So I personally have not signed up, but I am planning on going.
Yeah, under events.
You're not gonna.
Yeah, I would like.
Do you guys RSVP? Do any of the RSVP?
I did.
Okay, Charlotte
We're
said it
good.
was fine. Yeah.
We got it. We're good.
You're good.
So is that your report?
I think that it is, because we've said a lot. So I think we'll leave it at that. And I just want to thank you for the support that you gave me in making a selection for CFO. And I want to thank you for the support for our CPA. I'm looking forward to new direction. And still will say a whole lot of work has gone on in the last year and a half. We will never go this path again. And, I appreciate that I have had, the pleasure for you guys allowing me the opportunity to do that. Thank you so much.
Thank you, Kathy.
Is there anything else as far as Kathy, her CEO? Okay, so.
I see the next thing on the agenda is 5-minute break.
No, so we want to get the foundation done first, but Mary has a question.
I just want to, motion made by Ben, seconded by William, to give Kathy authority to engage Elevate CPA at $100 per hour to assist with accounting reporting issues.
Yeah, reconciliation. Yeah, basically to clean up our GL.
The GL cleanup.
I would strike to give, but the motion authorizes.
Yeah.
Doesn't give.
Okay. What do you?
Authorize. I have authority.
Till are your
County part's fine.
Okay,
cleanup.
So Dottie, did they have a foundation?
We did, yeah. Okay. And so it was kind of a short, brief meeting, but I guess the foundation, I don't know if they were meeting every month.
They've switched it. They were, every month.
And now they've switched it. They said they can meet 4 times a year.
Mm-hmm. Because that's their bylaws.
Yeah. And so, and I think they are getting ready to review some of those bylaws and maybe take out some outdated things, but she was not there, but they did welcome a new member, Jen Womack.
I met her, yeah.
On the foundation committee. She's Sagebrush Market.
Nice.
And so she is also the one that did our last foundation brochure, and we kind of looked it over and reviewed some things that needs to be updated and changed, but she did convey to Joanna Akers that she's got some really good ideas as far as fundraising, and I think she'll be a fresh perspective on the board.
Yeah, only other thing I should mention is that we did get a $50,000 it was trust money that's from Amazon investments and stuff from the Crows. So they've given us an additional $50,000. We'll be going back to the foundation board, and they know that we're looking at 2 things: a Therm, which was the piece we had talked about before that would allow patients to stay here and to avoid invasive procedures relative to not having to be intubated and on a ventilator. Less complications that way, can keep them in house. And the second thing we're looking at is a quick scan, because ours is ancient as dirt. And we would like to replace that so that we can do a competent job with that scan to be able to look at our trauma patients and see if they're bleeding, and that with precise accuracy, because the one we have right now, it sounds like it's a train wreck. It's like it doesn't have very good visuals, and it has to stay plugged in, and it's old. So we want to retire it and get a new scan.
So it's like a mini ultrasound.
Yeah, and the providers can use it. And really what it's really good for is you have a trauma come in and you're looking for a liver laceration, you're looking for pelvic bleeds, you're looking for those kinds of things, so that you know what kind of level of trauma you have with the patient based on that.
Anything else? So, on the bylaws, we did have a meeting, and we're starting the process and got through some, and we are going to have a meeting, if it works with you, William, on December 10th. Yeah, we already decided at 2:30. Yep. And so that's been myself and Mary and William and Kathy have been working that. And I'm kind of encouraged about it, actually. It went well. And William's doing all the work, so sorry.
No, the conversation's what at least in that first meeting, was most helpful. Everybody took part, and you get to see things you didn't see because someone else opened their mouth, and
Right. Yeah.
and then you go, "Whoa! I read that document. I didn't even see that issue."
So I'm encouraged about that. So anyway, and so do we want to take, is there anything else we need to talk about? Right, okay, so let's take a 10-minute break and we will get started with the executive session at 7:30.
You got 10 instead of 5.
Even all.
Well, that makes it even 7:30. If you want to, I
Don't
we
kill
can
me
make it
yet.
5. But we're not.
Is that a bid? You went 5, you went 10, gonna meet the middle
I
someplace?
think it would be good. That you can kind of pass it through this.
Keep it up, man. See where you're getting us.
Yeah, we can just, yes, we can. And I think that, what can I say to the
You like that?
yeah. That we have that, section 9 piece, thank you. That basically, we be going into it for the professional person or employee, and to consider receive information classified based on attorney-client privileges or that kind of thing. We do have some stuff that the council would provide to you all. So relative to some of our pieces on our audit.
Yeah, I move that we go into executive session under Wyoming State, I guess law 16-4-504A2 to consider the employment, right to practice or dismissal of public officer, professional person or employee, and 9 to consider or receive any information classified as confidential by law, including attorney-client privilege, communications, patient information, quality information, and trade secrets.
You mean Wyoming statute?
There you go, Wyoming statute. That's what I meant.
That's
Yeah,
good.
it was off somewhere there.
I'll second it.
Okay. All those in favor say aye.
Aye.
All those opposed, same. Okay, we are into executive session.
Gotta get it ready for me. Yep.
You'll get to hear that a lot. If we have a lot.
We're trying to cut down on.
We are trying to cut down, but it's
Yeah.
required by law.
Mhm.
Daylight. So it's rising.
Madam Chair, I have the time of regular session 8:12. Madam Chair, I'd like to make a motion to approve the credentialing for Jillian Kennedy, MD Radiology, Kelly Randerman, APRN Family Medicine, Roland Holcomb, MD Radiology, Brody Brisk, MD Radiology, Matthew Husterland, MD Neurology, and Gordon Stewart, PA Emergency.
We have a second.
Second.
William seconded. It's been moved and seconded. All those in favor of approving that credentialing?
Aye.
Okay, say aye.
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 All those opposed, the same. Okay.
Thank you.
Credentialing's approved.
There hasn't been anything I could vote against yet.
Motion to adjourn?
Now, wait a minute. Somebody mentioned having a special meeting, and if I remember,
I just didn't bring it to
you said
vote.
now you're adamant that
Thank you, Dottie.
Keeping you on.
Adamant is a good word.
Thank you. Good night.
Thank you.
Thank you.
Did you
I
make
made
a motion to end the meeting?
During the meeting.
Okay. All those in favor of adjourning the meeting, say aye.
Aye.
All right.
Could have voted nay this out.